Hey guys, this is Troy with the Advanced Spine Joint and Wellness Center here in Medina. Hey, this week we're talking about cervical disc syndrome and cervical disc degeneration. It's a problem that affects about 80% of Americans at some point in our lives, and it's starting to affect more Americans because of our forward head postures and a lot of our phone use and prior whiplash injuries. Cervical disc syndrome usually presents with pain in and around the neck area, but most commonly can send pain radiating down the arms. Now, cervical disc syndrome can occur for a lot of different reasons: disc bulges, disc herniations, and disc degeneration. Now, disc degeneration looks a lot like this model. There's damage to the joint. The disc in the center of the joint has become flattened, and oftentimes the joint fixates. And that makes these little tunnels here on the side of the joint smaller, and then pressure on the nerve. Occasionally in a good joint, here's a model of a good joint, we can see a much healthier disc, a large tunnel over here, but the disc could bulge and or herniate out of place, putting pressure on the nerve. And when these things occur, what we can do from a medical standpoint here at the Advanced Spine Joint and Wellness Center is what's called non-surgical spinal decompression. Now, spinal decompression is a big computerized looking table. And what it does is you'll actually sit in the table and there's a large halo that would come up around the head. And then we can program into the machine certain angles and pull weights. And essentially what we're trying to do is to begin decompressing or pulling pressure off the nerve. Now, there's traction and then there's spinal decompression. Most traction machines simply just pull. Spinal decompression allows us to pull at specific angles, but also it pulls and then it begins to relax, pulls and then begins to relax. And we oftentimes change the pull time and the relax time depending on the problem. And the whole goal here is to try to hydrate this disc again, which is like a sponge that used to be full of water, but now it's kind of smashed and dehydrated. And by pulling, we're bringing fluid into the disc space, and then relax, we're pushing it into the disc. We pull and relax over 12 minutes, and we can start to rehydrate the disc. Now, for disc herniations or disc bulges, what we can do is sometimes we use a longer and a little bit of a harder pull. And the reason being is if the disc slips or herniates out of place, as we pull, it creates a negative pressure in this space. It can actually bring the fragment back into the joint and pressure off the nerve. Non-surgical spinal decompression is typically painless. You don't really feel much, and it starts very slow. We don't pull really hard at first. It's something where we set pull weights in angles very slowly, and each session we're pulling a little bit more, little more, little more. Most decompression programs are somewhere between 12 to 20 visits, depending on the severity of the injury, the amount of degeneration, and how long the problem's been there. So if non-surgical decompression is something that you're considering or maybe heard of, you can find more information at our website. You can go to ohiopain.com and you can go under the physical therapy and therapies tab, and you'll find more information about decompression. If you'd like to schedule a consult formally for degenerative disc disease, spinal stenosis, disc herniations, or cervical disc syndrome, you can also contact us directly, 330-242-7669.